Now we want to bring in Dr. Curry-Winchell. She's the Regional Clinical Director of Carbon Health at St. Mary's Hospital in Nevada. Doctor, good to have you with us. I'm told that your colleagues often call you Dr. BCW. So very cool. Let's start with what we're talking about here. We've seen the CDC roll back its masking policy once, only then have to reinstate it later, especially when the Omicron variant hit. In your opinion, are we at a place now where we can say goodbye to masks?
Well, thank you for having me. It's really important that we look at the measures that we had in place for wearing masks, and that was in response to high infectivity rate. So if those rates are lower, we should respond accordingly and, not wear masks. However, if the rates are high, it is still important to wear a mask because that does provide a layer of protection.
Speaking of masks, as we said, Disney has announced it's going to drop its mask mandate for fully vaccinated visitors at their parks in Florida and California. So if you were taking friends or family there on vacation, how safe would you feel? Are there situations or settings where you might take more precautions?
Well, as a mom of two little girls and a fan of Disney, it's really important that when you visit a place like that you wear a mask if you are unsure of the vaccination status of others, just because you want to make sure that you protect your family as much as possible. So I would say in indoor places, or if you're around those that are unsure of the vaccination status, definitely wear a mask.
And the rule is if you are unvaccinated, you are still supposed to wear a mask there, of course. You don't know if the people around you are actually following those rules, which does make it a little more complicated. So right now, children under 5 are not eligible for vaccinations. New research from the CDC is shining a light on how moms-to-be can protect their babies. Can you tell us a little more about that research?
Yes, and so we now know even more that maternal vaccination really provides a layer of protection, not only for the mom, but our most vulnerable population, our children. And so the fact that we have a vaccine that can provide protection from hospitalization and severe death or actual death is wonderful. And so we really need to take note of this lovely way of protecting both mom and baby.
All right, Dr. Curry-Winchell, Dr. BCW, thank you so much for joining us. We appreciate it.
Thank you for having me.